In this trailer, we introduce a series of image-intensive webinars. The purpose of these webinars is to emphasize the visual aspects of human development. It is known that to look is not the same as to see. So, in these webinars, we are training the eyes not only of clinicians, but of all of us, since we all stem from a family. What we can see while looking is signs. And if we have appropriate knowledge, we can interpret signs as signals. But most often, what we see, we do not know what it means. In these webinars, we amalgamate, we blend elements that are essential in the clinical care of humans, regardless of the specialty. These are markers of prenatal development that may accelerate the diagnosis and result in better treatment and prevention. This blend includes teratology, genetics, dysmorphology, and clinical epidemiology. There are 6 descriptive webinars to prepare viewers in terms of what is going to be shown and what is the proper nomenclature to communicate one with another. Following which, there is a growing list of webinars that are topical, addressing attention to such things like why is alcohol so damaging to the fetus, the significance of cancer, aging, malformation syndromes, deformations, and so forth. Also across these webinars, we keep repeating that facts are objectives, that is science. Without them, the rest is hypothetical. Signals, etiologies, that is causes, interpretation of mechanisms, hypotheses of diagnosis, all of them are hypothetical. So remember that the gates to errors is framed by hypothetical interpretations. The antidote are signs, which are objective. The face is one of the most informative body parts, and it is self-evident that you look at faces to recognize your relatives. You would have a harder time to recognize them if you only looked at the 5th finger. Faces that speak to you are professionally called facies. And professionals have to have discipline. To look at a face, it requires that you focus on its components. Helter-skelter random looking at a face generally is less productive than being systematic. And as we uncover the face, its different parts, we then gather signs. As we uncover the face, we gain information. And the more we look, the more signs we collect, and the more certainty we reach. So, is this a facies? Yes or no? Are you sure? So if I uncover the rest of the baby, I'm going to uncover further collection of signs, positive or negative, normal or not, but that will make the surety grow. And as we show an increasing number of patients and images and works of classic art, The certainty of the eyes, the certainty of the ability to see grows exponentially. And here's a panel of 5 patients, and those who gain experience will be able to say, well, they are all alike and they are all different. In which way? What is what? And who is who? Is this one condition, or is a mixed panel of people with different developmental challenges? This is the style of an increasing number of medical examinations, and they pose a challenge because it's difficult for clinicians to learn from random clinical encounters. And this is what webinars can do. They can cluster patients for the purpose of training. And also, concurrently with these webinars, we have master classes. And you better believe it that they are critical. This series of master classes, for instance, include one, actually not one but 3, by Professor Kenneth Jones on dysmorphology, that is distorted morphogenesis, distorted the shape of things being developed before we are born. And he speaks of how to recognize signs of fetal alcohol damage, that is, alcohol that negatively impacted a fetus. Images trigger the imagination. We say our imagination. For instance, on the left, we see a nest. We all come from one nest or another. On the right, we see twins, and they are conjoined. And as we go with these webinars, we present fundamental observations that are about life, biology, and along about terminology. So, what is ecology? What has epidemiology to do with this? Is because everything that surrounds a human being has an impact on its development. It is an amalgam of the population, environment, home circumstances, reproductive histories, family histories, and so forth, with an observation of morphology or alterations like dysmorphology. And then way far to the right, we reach questions of ethics. Should these conjoined twins be separated? It's a high-risk operation. Are they better off staying alive joint? And so forth. And then finally, the lack of harmony between financial pursuits and the care of patients. This is often creates ethical dilemmas. For you and me, life begins at fertilization. One egg, one sperm. But then there has to be some order, and the very first event is the appearance of an axis. What is going to be the head? What is going to be the tail? What is left and right, front and back? And along this axis, there is an elongation of a plate, embryonal plate, that will give rise to all of us. But it's not always normal. Occasionally the axis can be duplicated, and there are 2 axes, and then what we get is twins. And as you know, twins are fairly common, and very rarely people think of them as a quote-unquote birth defects, but it is a birth defect. It is not expected in humans for one egg to become 2. And sometimes they don't separate. Sometimes they are conjoined, as I just showed you. I also mentioned if they are joint, they may pose an ethical question of separation, not separation, etc. And then there is a profound question. One of the 2 twins or the conjoined twins begins to die and eventually dies, and there is only one left. Those are singletons, but they are different from other singletons because they are the product of a pregnancy with a vanished twin. And here is reality. Here is a little girl that had a twin as a companion, and that twin disappeared, vanished. And notice that she has a midline tooth. Is this fusion or lack of separation? Is this related or not? Interpretations are hypothetical, but she is reality. She is not growing. Her intellectual development is not complete. Her behavior is difficult. And is she or is she not a case where the vanishing twin had an impact on the remaining one? So these webinars are produced by the speaker, and you can read about my background at leisure by stopping the motion. So now it's time to end this trailer. I invite you to join and register, and those of you who are students may apply for reduction or waiver of fees. Those of you who are ambitious may get a certification of participation, or even more so, diplomas of proficiency if you take a test. I hope to see you soon, and until then, with my very best wishes, I say goodbye.